Good afternoon, everyone. You found us here at 2 p.m. My name is Brittany Cadence. I'm the Communications Manager for Peterborough Public Health, and thank you very much for your flexibility today to joining us at this later time for our weekly briefing. Thank you for pivoting with us, and we do hope to resume these going forward at the 12 noon mark next week. So. We're thrilled to have you here. Thank you to all of our elected officials who are on the line to join us on this interesting day, which started off with snow and now I see sun outside my window. I'm going to take a moment to pause and give a land acknowledgement to honor this beautiful place that we call home. We respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Bull Soleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these beautiful lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, so to start us off on our weekly update of the COVID-19 situation, I'm now going to invite our Board of Health Chair, Mayor Andy Mitchell, to start us off with some opening remarks. Please go ahead, Andy.
Thank you, Brittany. We've experienced difficult challenges in the battle against COVID-19 this past week. Case counts are up across the province, hospitalizations are increasing, and our ICUs are being filled. People are frustrated, public health is stretched, and governments are having to make difficult decisions. After 13 tough months, a few have begun to indulge in a blame game. Easy to play, but producing little in the way of results. Yes, there is a culprit. It's called COVID-19 and its variants. And it's a wily foe. It grinds us down, and in doing so makes the only sure way to beat it harder. That is, working together and depending on each other. What each of us does isn't only about keeping ourselves safe, it's about keeping all of us safe. Without you, and you without me, none of us will be able to defeat this virus. To be clear, there is no magic bullet, no government policy, no vaccine, no public health measure, and no activity that by itself will secure our safety. It isn't one thing that needs to be done, but many things, and often, and over long periods of time. Please, everybody, enjoy the long weekend and celebrate Passover and Easter safely with members of your immediate household only. Embrace hope. It gives us the power to seize the moment and to shape the future. Please continue to practice public health measures. Avoid large gatherings. Keep physical distancing. Wear a mask. Wash your hands frequently and stay home if you feel ill. Now, more than ever, enjoy the moments with members of your immediate family. Forget perfection. Indulge your inner child. Stay safe, be well, and in all things, be kind. Thank you.
Thank you very much, Andy, for those wise words as we head into this important time of year. Okay, I will now invite our wonderful medical officer of health, Dr. Salvatierra, to lead us through a few slides that outline the current COVID situation. So please go ahead, Dr. Salvatierra.
Thank you, Brittany. Hello, everyone. So let's start with the situational update. As of 4 8:30 p.m. yesterday, there were 52 active cases here in Peterborough, which are 3 fewer than reported last Thursday. Our total case count stands at 875 cases to date. That's 47 more than last week at this time. There have also been an additional 34 cases of variants of concern reported to us this past week, bringing the total number to 199 presumed variants of concern. You will notice that we are reporting variant cases a little differently now, with a single indicator of total cases, and that's due to a change in provincial testing. The number of high-risk close contacts is similar to last week. Right now, our team here is following 199 high-risk contacts. That's just one less than last week at this time. The total number of COVID deaths remains at 10. Next slide, please. This bar graph shows that, I'll just wait for it to catch up here. Mine is blank. Are you seeing anything, Brittany, or my?
Oh, it advanced for me.
Oh, there it goes.
Did it pop in? Okay.
Just took my computer a little bit longer. So this bar graph shows that the weekly number of cases continues to trend down very slowly. So far this week, there have been 21 cases reported. However, I must say it's been very volatile, and we had one large one-day spike earlier this week. The next graph shows you the monthly bar graphs, and you can see that March 2021 was the highest monthly case count so far in this pandemic, with 225 new cases reported that month. When we look at exposures, the breakdown remains consistent as previous weeks, with the largest proportion of cases being identified through contact tracing of high-risk contacts. Next slide, please. We currently have 4 active outbreaks in our community. The outbreak at Brock Mission was declared over earlier this week, and the other 2 outbreaks at Empress Gardens and at Trent University Zowski College student residents are stable. 2 new outbreaks were declared yesterday in 2 different workplaces. Both of these workplaces have less than 10 staff. One workplace has 5 cases, and the other one has 3 cases. Due to their helpful record keeping, our contact tracing team has been able to reach everyone who has been impacted, and all high-risk contacts are now self-isolating. Next slide, please. So here we have a bar graph that is showing Ontario's case incidence rates, and it's a little noisy, but I will try and describe it to you. First, we'll begin on the right-hand side, where you see that our weekly case incidence has increased marginally again to 28 cases per 100,000, up from 25 per 100,000 next week. But when you look at the bar graph, and here you'll see along the bottom, you'll see all the different public health units. On the left side are all of the public health units where from March 15th in yellow to March 28th in blue, they have seen significant increases in their cases. On the right-hand side are the few of us where we have actually seen a decrease. So you'll see Peterborough there. You'll see a slight decrease where we went from a higher incidence rate when we had our outbreak at Severn Court down to a lower incidence rate. So we are among the few public health units where we had our variant of concerns spike earlier, and all of our proactive work and all of your collaboration has really contributed to containing it. I just wanted to share that because this becomes relevant when I speak about the Premier's announcement in just a few minutes. But before that, we have another slide which shows the color zone across the province, with the Premier announcing this afternoon that there will be a provincial shutdown for the next 4 weeks. The framework shown here will be suspended, and we will emerge back into this framework at the end of 4 weeks, and that will be consistent. The color will be consistent to our data at that time. Our next slide is our wastewater surveillance data. So you can see the in blue, the results from testing at our water treatment plant here in the city. And you can see that it's actually showing lower levels of viral detection, which I find very reassuring. Again, I think it shows that we've been making progress here in Peterborough. Next slide, please. We've also been making progress when it comes to immunization, and we've now immunized more than 30,000 Peterborough residents with their first dose of a COVID vaccine. The good news is that 84% of our 80+ population has now had at least one dose. 40% of our 70 to 79-year-olds have had their first dose. And already, thanks to our primary care pilot with AstraZeneca, 30% of our 60 to 69-year-olds have been done with their first dose. So congratulations to all our immunizers out there. With the provincial shutdown due to begin after midnight tomorrow, I am hoping that everyone will have a peaceful and re-energizing holiday weekend. I would like to remind our 30,000 residents who have already received their first dose that it takes 2 weeks for the vaccine to become effective. So please, please remember that the safest approach is to socialize only with your household members and to stay at least 2 meters distant from anyone else, wearing a mask, even outdoors when around others who are not from your household. And if you can, when the weather is good, please get out, spread out, and enjoy the outdoors. I'd like to begin by saying that I support the Premier's decision for a provincial shutdown. The new variants of concern, which we've had a taste of here in Peterborough, now account for 67% of all Ontario COVID cases. They are associated with a 63% increased risk for hospitalization, a 103% increased risk of an ICU admission, and a 56% increased risk of death. The number of Ontarians hospitalized today is 21% higher than at the start of our last provincial lockdown, and our ICU occupancy is 28% higher. Believe me when I share with you that our healthcare workers, whether they are in hospitals or here in public health, are straining under this very heavy load. And this is at the same time that we are putting needles into arms. I know that you know as well that the data we look at today is usually about 14 days behind what's really happening, and that the full burden of hospital admissions and deaths will become more apparent 2 weeks from now. This 4-week shutdown will give us more time to immunize and protect as many people as possible. Today, we have opened up appointments for everyone born in 1951 or earlier. And I have heard already that many happy 70-plussers in Peterborough are already they have their first appointment to get their COVID vaccine, possibly as a Passover, or Easter gift. Our clinics will be open every day this weekend. We've also heard the good news that more AstraZeneca vaccine will be coming to Peterborough, perhaps as early as this weekend as well. And this will be made available to people aged 55 years of age and older. I believe there is a provincial website online where it is possible to enter your postal code to find the pharmacy closest to you. I am sure that by now everyone has heard that the AstraZeneca vaccine is being paused in people under the age of 55 years in Canada, based on NACI's recommendations that will allow for more time for those rare blood clotting events that have been seen in Europe to be studied. This pause is precautionary, but it does demonstrate how the post-marketing surveillance done with vaccines is able to detect a possible signal, which can then lead to actions such as the current pause in an effort to ensure the safety of the vaccine. We've seen how quickly those systems have worked. And I hope you will be reassured to know that those systems are in place right here in Peterborough and throughout Canada. Health Canada has required that there be a warning added to the AstraZeneca vaccine that will advise recipients of the risk for the rare immune reaction so that they can monitor for possible symptoms and seek medical attention. Vaccine-associated prothrombin immune thrombocytopenia, or VIPIT, can be treated if identified. Our physicians are aware of how to make the diagnosis and how to manage VIPIT if needed. And patients will be provided the information they need to make both an informed choice as well as to recognize any possible signs and symptoms. By sticking to people over 55 years of age, it may be that these rare events can be avoided or at least greatly diminished if they are indeed linked to AstraZeneca vaccine. But it is still too early to tell. In the meantime, it's important to recognize that the risk from COVID includes increased risk of blood clots. The AstraZeneca vaccine is very effective at preventing COVID and even more effective at preventing severe disease, hospitalization, and death. Please remember that the best vaccine continues to be the first one that is offered. And I encourage everyone to get immunized as soon as possible. Thank you.
Thank you very much, Dr. Salvatierra. Okay, so we are fortunate to have with us some of our elected officials. So I will now invite MP Miriam Monsef if she has some comments to share, and I'm happy to put you up on screen and encourage you to go ahead.
Thank you so much, Brittany. Hello, everyone. Bonjour, Anin. Salam alaikum. As always, I'd like to begin by acknowledging that I'm on Mississauga territory and to thank Dr. Salvatierra for your thorough work and the briefing here today. Andy Mitchell for your wisdom and guidance, and to every single one of our frontline healthcare workers and immunizers. 30,000 shots in arms. Thank you. Thank you. Our government will continue to be there to support provinces with the tough decisions they're making. Our programs are in place for Canadians in need during this very difficult time. And we'd like to remind Canadians and our wonderful neighbors and friends here in Peterborough Kawartha to continue to follow public health guidelines and to avoid gatherings and travels. We are also mindful of vaccine confidence. The right vaccine for you is the one that is first available to you. You've also seen back and forth on social media about vaccine numbers, and let me say this. We said that we would deliver 6 million doses by the end of March, and we're actually finishing this week with 9.5 million doses. This week, Canada's scheduled to be receiving our largest ever single week shipments of vaccines, 3.2 million, which will bring our total vaccines received by the end of this week to 9.5 million, well in excess of the 6 million originally scheduled. This includes 1.5 million AstraZeneca doses from the United States, which earlier today received the final administrative green light necessary from Health Canada in order for it to be administered in Canada. These vaccines are already here and now will be distributed to provinces immediately. 583,400 doses, about 39%, are allocated for Ontario. The Prime Minister also announced earlier this week that the Pfizer vaccine will be accelerating its shipments in Q2. We will continue to receive a little over 1 million doses a week throughout April and May, and in June, we will start receiving 2 million doses per week. This means 5 million Pfizer doses will be received in Q2 for a total of 17 million Pfizer doses alone over the next 3 months. We're expecting to see deliveries of the one-shot Janssen vaccine developed by Johnson & Johnson to begin arriving before the end of this month. As more and more vaccines come into Canada, it's important to remember that all approved vaccines in Canada provide significant protection from the most severe outcomes of COVID-19. Don't wait. Once you're eligible, get vaccinated. The right vaccine for you is the first one available to you. I'd like to now speak about Passover, Easter, and travel during this long-awaited long weekend. As we work to bring as many doses of vaccine into Canada as quickly as possible, we need everyone to continue to slow the spread of the virus. This means following the public health advice that Dr. Salvatera just provided, such as wearing a mask and staying at least 2 meters apart, using the COVID Alert app, staying at home as much as possible, and avoiding all non-essential travel. I know that in the midst of another province-wide shutdown, there's a lot of anxiety out there and there's uncertainty about people's jobs and businesses and how they will be impacted by this. The federal government has programs in place to help. The enhanced EI program will provide a minimum of $500 a week for up to 50 weeks. The Canada Recovery Benefit for those who might not qualify for EI has been extended from 26 weeks to 38 weeks. The Canada Recovery Caregiver Benefit has been extended too from 26 to 38 weeks, providing income support of $500 per week if schools or childcare centers shut down and you have to take time off work to care for your child or children under the age of 12, you qualify for this benefit. The federal government's paid sick leave program, the Canada Recovery Sickness Benefit, has been doubled from 2 weeks to 4 weeks. If you need to take time off work because of COVID-19, including self-isolation because you've been deemed a close contact, you qualify for this benefit. For businesses, the wage subsidy will provide up to 75% of your employees' wages. The CEBA loan program is still accessible and provides partially forgivable loans of up to $60,000. Up to $20,000 of this loan is forgivable. The rent subsidy program provides a rent subsidy of up to 65%. And if your business is disproportionately impacted by a provincial lockdown order, that rate can rise to 90%. These programs are available. If you'd like more information about them, visit canada.ca/coronavirus. We will get through this together. And this long weekend, my family and I are sending yours peace and joy. And we're also thinking about families who have loved ones in ICUs, families whose loved ones are carrying the burden of COVID in healthcare settings, and families who are mourning loved ones lost. Let's keep pushing. Together, we will beat this virus. Thank you so much to all healthcare workers.
Thank you very much, Miriam, and a wonderful long weekend to you as well. Okay, we also have with us several of our municipal representatives, and I'll invite Mayor Diane Therrien if she has some comments to share. Please go ahead and let me know if you'd like to be on the camera or not.
Yeah, if you can see me, I'm on my computer that has camera capabilities today. So happy to be here. Thank you so much. I know that most of us jumped over from the press conference that was happening. So just to make a few comments, I've said I've supported what the province has decided for many months, although I have said before, and I'm going to say it again today, this is not a full lockdown. Big box stores are able to continue to operate with impunity. Small businesses and self-employed people are going to be the ones to suffer. Frontline essential workers still do not have adequate access to paid sick days, and schools will remain open. So this is not going to get us to COVID zero. I've said before, I realize the Premier and his team have tough decisions to make. We all do. But I've also said that if you're going to do a lockdown, in my view, to prevent the spread in a meaningful way, a lockdown needs to be tough across the board and enforced. And without that happening, I'm worried that we're setting ourselves up for another wave and shutdown and an unsustainable pattern going forward. In my view, this is not a sustainable way to approach healthcare, to do business, or to begin to address the myriad of complex issues that have pre-existed and also been exacerbated by the pandemic: housing, mental health, opioids, and addictions. So, I understand the tough decisions that need to be made. I'm skeptical about the impact of this when we still have some businesses that are able to remain open, particularly those big businesses that are the ones that we have cases linked to, where our small businesses and our downtowns are not going to be able to open, and we've had no cases linked there. So I'm very concerned for our community. I'm very concerned for the financial and mental well-being of people in our community. That said, will continue to work with our government and community partners, as I have and always will, to protect our residents. And I will continue to encourage our MPP and our Premier to facilitate the distribution of more vaccines in the Peterborough-Kawartha region. I know that our healthcare workers are doing a bang-up job of getting those out. But we need more. So I'll leave it at that for now. This weekend, again, it's going to be nice. People are going to want to get outside. We're asking everybody to be smart, to be vigilant. Hopefully we get through this. And then this time next year, we'll all be able to hang out together in one big group hug. So I'll leave it at that for now. Thank you very much, Brittany.
Thank you very much, Mayor Therrien. Glad you could join us today, and wishing you a wonderful long weekend as well. Okay, so let's hear from County Warden Jones. I'm sure he's got some great messages to share with us, and I'm happy to put you spotlighted on the screen if your camera is cooperative.
Okay, my camera is doing its thing, but that's okay.
Oh, you're a little quiet, actually, Warden Jones.
A little quiet, you say?
Yes. How often do you hear that?
How about that?
Oh, that's brilliant. Thank you.
Okay, anyway, thank you. I certainly won't go on for too long. I agree with what Diane has said, and further to what Andy said. To me, the biggest thing is, let's stop this pointing fingers and blaming somebody for this, that, and the other thing. Let's stop it, and let's just do what we have to do. In my limited travels around the county lately, it's very frustrating seeing 5-10 cars in driveways or even more, and people getting together. We've all got to participate in this, and we've all got to do what we need to do, and don't just fluff it aside. Otherwise, we wouldn't be in this predicament again, as announced today by the Premier. So, let's bite the bullet and do this. We just did a little video for all the county staff, thanking them for everything they're doing, because our county people are doing a wonderful job. And again, I salute our paramedics, our public works people who are there on the front lines. And we've all got to just buckle down and do what they tell us. We've been saying this for a year. So let's just give ourselves a little tap on the head and remember that. And please do what we have to do. And to Rosanna, thank you again very much. And you know who I want to thank? And that's you, Brittany. You're always there on the front lines with the media and with all us politicians and trying to be that go-between, and you're doing a great job. Communication through this is so important, and you're doing exactly what you should be doing, and you're doing a great job at it. And I know the media also appreciates your liaison duties, so thank you for that. So on behalf of all of County Council, on behalf of the 55,000 people in Peterborough County, we're all in this together, and please have a happy Easter. We're going to get through this. And Diane, I want to be part of that group hug. Thank you.
Thank you very much, Warden Jones, and for your kind words. I certainly have a great team with me every step of the way who are making this possible. So, and I would like to thank the media as well. They're playing a huge role in helping us get the message out through events like this. So, and wish you also a wonderful holiday. So let's now move it over to our media guests, and I'm going to work my way through the participant list, and we'll start with Matthew Barker. If you've got some questions for Dr. Salvatierra, please go ahead.
Not at the moment, thank you.
Okay. Okay, well then I will move my way to Donelda Fraser from the Havelock Rail. Do you have questions for us today, Donelda?
Nothing today, thanks.
Okay, great. Then Bill Hodgins from Peterborough This Week in My Kawartha. If you've got some questions.
Yeah, can you hear me?
Yes, I can.
Okay, great. Just I'm curious. I saw in the Toronto area in the last few days that they had a lot of, I'm going to say, vaccination spots that were left open at the end of the day, particularly towards the end of the day, because a lot of people picked the earlier sites. Have you seen anything like that happen in this area?
No, all of our appointments get filled. So we have a real hunger for vaccine here in Peterborough, and it's great to see. I mean, I think that, you know, the fact that we're looking at 84% of our 80 and over that have already had at least a first dose, that's remarkable. That's a, you know, so I'm looking forward to more of that. And we will be able to provide data at the end of each week. Going forward, we're going to create a dashboard so that you can follow along and see how we're doing.
And just one more question, if you don't mind. Some of the education unions in the area were wondering about making teachers and educators a little higher on the priority list. How much flexibility do you have to, I guess, stray from provincial guidelines if you wanted to make that available?
I have some flexibility, you know, to address if we have major, for example, if we had an outbreak in Peterborough and it became necessary to immunize as part of that. I have that kind of flexibility. However, phase 2 guidance has been provided to us by the province, and we are to complete the age intervals first. So I know there's a lot of interest from the even at the provincial level, to try and get through all of those age intervals fast, because they are associated with the greatest risk of death. And as soon as we can get those age intervals completed, then we can move on to some of these other groups like the essential workers. I completely understand that they are very eager to be immunized, and I hope we can get vaccine to them as soon as possible. But it's just going to depend on our supply.
All right, thank you very much.
Okay, thank you very much, Bill. Jessica Nisnik from Global News. If you've got questions, go right ahead.
Thank you, Brittany. Dr. Salvatierra, hello.
Hello.
Do you have any news to share from your 12:30 phone call? Or is it just an update on what's going to be happening?
I think what was shared with us at 12:30 was just a heads up of the Premier's decision, so that we could do things like prepare our comments for our media scrums. I was very grateful to get that advance notice so that I could put together some comments to share with you. So essentially, it was just that we were moving into a shutdown. The terms of the shutdown are described under Regulation 8220, I believe. We're still waiting to receive an updated version so that we can understand more in more detail what the restrictions will be. So we'll get a better sense of that today and tomorrow, and we will be sharing that with all of our community partners so that we're all aware of what those rules will be for us over the next 4 weeks.
Okay, thanks. You know that that this is going to upset a lot of small business owners, especially that big box stores can still stay open. You know, we've seen evidence that in Toronto and other cities that the restaurants aren't open and some retail stores aren't open, yet their cases continue to climb. So that's a message that's been coming out of small businesses in Peterborough. Like what kind of message do you have for those small business owners that this might do them in this last lockdown?
I'm going to have to just ask for a bit of patience so that we can get the regulations and understand in more detail what the true extent of this shutdown will be. I just don't have that kind of granularity at the moment, Jessica. So I'm going to pause and wait before answering that until I do have more clarity and more certainty.
Okay. What else was I going to say? So the AstraZeneca, you know, with other provinces pausing, I don't think that there's a lot of confidence in that vaccine. And I know you're saying to get the first vaccine that's available to you, but I really think this is going to delay a lot of people from getting it. You know, I guess there's only so many times you can say it's safe, but is there anything else you'd like to say on that? Because it seems like, again, if other provinces are doing it, it really sets a precedent, I think.
So all with the NACI recommendation, all provinces I have hopefully have heard that it's to be used in people 55 years of age and over. So certainly we have seen that change here in Peterborough here in Ontario. So we have been advised that the AstraZeneca coming into pharmacies and going to primary care will be only available for people aged 55 and over. So that does address some of the risk that has been associated with the vaccine, particularly in younger women. They won't be, it's not recommended for them. I think in addition, we now understand a little better how to identify if people are running into problems and how to identify them and diagnose them early enough that they can be managed. So this rare immune event is something that can be treated. And so I think we are now armed with that knowledge. Anyone who's choosing to receive the AstraZeneca is also better informed. And I hope that will just make this vaccine that much safer because it is a good vaccine. It does prevent COVID-19, and it's even better at preventing severe disease, preventing hospitalizations. It works just as well as the Pfizer and Moderna at keeping people alive and keeping people out of hospitals, which is what we need right now.
Okay, thank you. One last question. You know, you've said in the past that you think more restrictions or better enforcement, I believe. You know, I like J. Murray Jones, I'm seeing, you know, up to 10 cars in some driveways when I'm on my way home. Do you think that this is going to make a difference if this lockdown, as we've gone through now for a third time, if enforcement doesn't happen?
Well, I do, and thank you for raising that, Jessica, because I think, certainly we learned through our Severn Court outbreak that what's really needed is a quick response whenever there is any potential non-compliance going on, and whether it's unorganized private gatherings or elsewhere. So I really hope that residents will take immediate action, that they will report immediately to our local police, whether it's our city police or whether it's the OPP for people living outside of the city, so that they can investigate. That's really what's going to make the difference, is that swift reporting, that kind of immediate action, so that we can shut these things down before transmission takes place. As we saw with the Severn Court outbreak, by the time people are sick or dying, it's too late. So we all need to be vigilant, and we all need to take that responsibility and do that collectively.
Thank you, Dr. Salvatierra. That's it for me.
Thank you, Jessica. Okay, I believe we have Matt Latour with us from Freak and Oldies Radio. If you've got questions for Dr. Salvatierra, please go ahead, Matt.
You must be on mute, Matt.
Or maybe he's just stepped back for a bit. We can come back to Matt.
Okay.
Okay, then let's hear from Paul Rellinger from Kawartha Now. Go ahead, Paul.
Thank you so much, Brittany. And just for the record, I got my AstraZeneca and I'm feeling great. So,
good
so
stuff.
far.
But remember, Paul, it takes 2 weeks. 2 weeks to work.
Yeah, you're right. I might have spoke prematurely. Let's hope not. I had a couple of questions for you, Dr. Salvatierra. You heard what Mayor Therrien had said just a few moments ago in rather strong terms about her opinion on lockdowns and the timing of them. And I want to ask you, I know you take your direction from the province and from your superiors in public health, but admittedly, is there a little voice in the back of your head that over the last couple of weeks that said, we have to lock this down? I mean, you saw the numbers rising up, and it's almost like we got to this point today, but we all knew it was coming. And was that your sense as well?
Well, as you know, Paul, we have been very vigilant here in Peterborough in that we did issue instructions to all of our food premises advising them that it was household members only to be seated, both indoors and outdoors, even before the province clarified it, because we recognized how risky it is to eat together. And so we've been very proactive here, and I think that has made a difference. If you look at our numbers in Peterborough, and if you look at even what our wastewater surveillance is showing, despite the fact that 80% of our cases are variants of concern, we've been able to do a pretty good job of containing the outbreak. Not that it's over, and not that it can't change dramatically in 24 hours. We are not out of the woods yet. The only thing that's going to end this pandemic is immunization. And so I agree with you. I think this has been building for the last several weeks. We've seen the numbers start to climb back again. And I hope that the actions now that are being taken and also, by doing it provincially, discouraging travel, because that's what also gets us is travel, because the virus, that's how the virus moves. So having the whole province go through this together, having hopefully people staying local and not traveling, and maintaining only our essential services just to buy that extra time. And we will immunize as quickly as we can. We will do our best to use up every dose of vaccine so that we can bring this community to a place where it is more safe to be open and more safe to be together again.
Perfect. And just a couple more things. You may have mentioned, and I apologize if I missed it. Do we have any word on vaccines coming to pharmacies here and that when that will start?
Yes, we have received word today that there will be AstraZeneca coming to pharmacies in Peterborough. I believe there are 3 pharmacies starting. This will increase as supply increases. We were told that the vaccine may arrive this weekend. So
Okay.
I would encourage people who are interested in getting their AstraZeneca to go online and check to see which pharmacies and then follow up with those pharmacies. In addition, we will be getting some additional AstraZeneca for our family physicians and nurse practitioners. They have completed their pilot, but the province is going to provide a little more vaccine for them as well, so that if they have patients that they would like to invite to be immunized, that they also have vaccine.
Okay. Will the health unit be identifying which pharmacies they are at some point to help people?
I'm going to turn to Brittany to see whether we have that information yet. Brittany?
Yeah, I can help with this. Actually, Paul, I'm just about to forward you the news release that the ministry issued today that announces AstraZeneca available in pharmacies, and there's a link that lists Peterborough locations on their webpage. So I'll send that to you so you can see the locations.
Perfect. That's very helpful. Regarding Dr. Salvatore, regarding the outbreaks, you mentioned the 2 in the workplace. I know you can't or won't identify them specifically, but were they customer-oriented workplaces or like a business industry with just employees?
So one is a workplace with customers. So customers have all been contacted, and again, because of the good record keeping, we were able to get everyone that could have been exposed. And the other one is more of a traditional workplace, Paul, I believe.
Okay, perfect. And I had one more thing here. Just bear with me. I'm sorry. You mentioned the percentages and you broke it down by age of people who received the vaccine. Do you have a percentage number for what that total of about 30,000 represents for our whole region in terms of everybody who could get the vaccine? Like, is it 3%, 4%, 5%?
No. So the 30,000 that have been immunized represents about a third of the total population that we are hoping to immunize. So we're hoping to immunize about 94,000. And so the 30,000 is about a third, with first dose only though, remember, because we will need to do a second dose.
And that 94,000 represents all age groups that will be vaccinated?
Well, currently the vaccines are only licensed in adults, so 16 or 18 and over. So it's only that percentage. It's 75% of our adult population. That's how we've derived that number. So that's the minimum we would want to see to be able to achieve herd immunity. Now, you may have heard that Pfizer has had a preliminary announcement of its trials in younger adolescents. So, so we may see the licensing change. In addition, we do know that there are trials currently underway now in children as well. So as the licensing changes, as these vaccines become available to children, we will change our numbers as well.
Okay, and one more thing, and it kind of ties back to what Jessica was asking about enforcement, and I'm the bad guy who asks this every week, but is there any update at all on Severn Court that you know of, status quo for that situation in terms of any charges or actions?
So we unfortunately do not have enough evidence on the Severn Court outbreak to reasonably lay charges for the events that allegedly transpired on or around February 20th. So it's unclear from what we know where those gatherings were, who hosted the gatherings. We do not know if everyone who attended a gathering has disclosed that they were there. We have reports of several gatherings that occurred at the same time, and we have no proof that the indoor capacity limits, which at the time were 10 people, were exceeded in any of those gatherings. So we just don't have enough good evidence to be able to take any further actions at this time, which is why I ask that people call right away. If you believe you are seeing a non-compliance with the limits, or that you're potentially witnessing social gatherings that should not be taking place, I really encourage you to report this immediately, and by calling the local police or the OPP on their non-emergency lines.
Okay, so the investigation is closed.
I would say so.
Okay. Thank you so much, Dr. Salvatore. Appreciate your time, and sorry to take so much time, but I appreciate
No,
it.
it's quite all right. In fact, Paul, I thought you were going to ask me whether there were going to be any clinics in the county. But because I know you do like to take more of a regional approach. So may I add that in fact we are planning clinics in Buckthorn and in Apsley and in Millbrook, and that we will have updates on those clinics, I would say soon. And once we load them up into the provincial booking system, residents will be able to book their appointments there. So there's some good news coming for our rural residents.
You're right. I should have asked that question. So thank you for bringing it up.
You're welcome.
Thanks so much.
Thank you very much, Paul. Okay, Trent Radio is with us today. Rob, if that's you, do you have any questions for Dr. Salvatore?
Hi, yes, it is me, but I think everything I had has already been gotten to. Thank you very much.
Okay, great. And then last but not least, we have Reg Watson from the Examiner. Any further questions today, Reg?
Could I just ask Dr. Salvatore, can you confirm the statement that was made earlier on this call that there have never been any COVID-19 cases linked to any small businesses in Peterborough City and County during the pandemic?
No, I did not make that statement.
Yes,
so
I realize you didn't make it, but it was made on the call, and I just want to be accurate about what actually has happened.
I would suggest that the statement isn't completely accurate, but I would have to check back with my case and contact management team, because I don't have that information with me. We can certainly look that up, though.
Yeah, we'd appreciate if you could look that up. Oh, thank you. That's all my questions.
Okay, great. Thank you very much, Reg. Okay, I believe then we have made our way through all of our media today. So that wraps things up and leads me to an opportunity to wish everybody a wonderful long weekend. And thank you for joining us and for making the last minute change to be here at the new time. But we do anticipate next week that we will be reconvening at the 12 noon mark, and we will see you all then. So be safe out there, and thanks again for joining us. Bye-bye.
Thanks, Brittany.